Welcome to the British Academy of Audiology and the British Tinnitus Association Tinnitus module. This module has been made available as widely as we possibly can because what we want is everybody that greets a patient who has tinnitus to have a basic understanding of what they can do to help and what they shouldn't do, and what they shouldn't say to patients. My name is Sue Falkingham. I'm a past president of the British Academy of Audiology, and I'm really pleased to be the person that's introducing this module to you. So let's get on. There was a piece of research done in 2015 that was sponsored by the Ear Foundation and commissioned by the British Tinnitus Association. This piece of research looked at how much support people with tinnitus got, and it looked at genuine patient stories, and it asked patients where they were getting their support and how they were getting that support, what had happened when they'd seen somebody in general practice and what had happened when they'd seen audiologists. And it highlighted that as part of a general assessment, repair or reassessment appointment, our patients weren't always being asked about their tinnitus and about a tinnitus experience. So it's often more of a tinnitus experience that we should be talking about to our patients rather than a tinnitus. Rather, it's more of the tinnitus experience we should be talking about. We should be finding out what impact that tinnitus has on the individual person. And it should be a routine inquiry to all our patients who have hearing loss or who are deaf. So it's really important that we follow those recommendations. And as BAA, we wanted to do as much as we possibly could to make that easy for our members and wider health professionals to do. We found that the greatest impact of tinnitus was experienced by those with greater levels of hearing loss, and actually they were the ones that were much more likely to have been discharged from services and not given any support because they were routine adult patients who'd had their hearing aid changed. They weren't coming in to see an ENT consultant. They weren't necessarily even consulting their GP anymore about their hearing loss. They were literally walking into audiology appointments for spares, repairs, and reassessments. So it's really important that audiologists are aware of this, are aware that nobody else is asking, but are also aware that tinnitus could develop later in the patient journey than that first assessment appointment. So we just want everybody to be able to have a basic tinnitus conversation. We should be alert to the potential presence of tinnitus and its effect on hearing tests. If you read the BSA recommended procedure for audiometry, it asks you to make sure you ask that question about tinnitus, and it gives you some tips on what you might do during diagnostic testing if somebody does complain about their tinnitus. So we want people who are audiologists to think about their professional development regularly and continuously, don't we? We talk about continuous professional development. And one of the things we can include is more counselling training. And it's something that more audiologists should be confident in offering some counselling to patients with tinnitus. Even if it's that there's nothing we can do around the tinnitus, we can certainly work on how we phrase that, how we show empathy, and how we support an adult to find their own way of managing tinnitus. There seems to be a link between the impact of tinnitus and the individual self-esteem. So if somebody is very impacted by their tinnitus, and they will seem to have a lower self-esteem. So it's not necessarily about tinnitus severity. And I think that's something really important to say at the outset of this module. Just because somebody describes to you a quiet noise or a noise that they say is just a buzzing or a whistling in the background doesn't mean that they won't feel the impact of that tinnitus. So don't just think that it's loud tinnitus and therefore it's going to be severe. I can tell you a story about a lady that I was seeing a long time ago in my career, and I asked her to describe her tinnitus, and she said it's like standing under a waterfall with two jet engines behind me. It's really that loud. And then I asked her about, and how do you cope with that? And she said, absolutely fine. I have no problems with my tinnitus at all. So what we need to find out is that personal experience of tinnitus and help the patients to take ownership of their tinnitus and be encouraging them on a journey of tinnitus management. We shouldn't avoid talking to people about technology when we talk about tinnitus. So we do want people to think about hearing technology, even if their main complaint is tinnitus. And you will find that since we originally wrote this module, the NICE guidance have been updated, and it says that anybody with hearing loss and tinnitus should be offered hearing aids to manage their tinnitus. Even very mild losses, we should be considering a hearing aid fitting for those patients too, if they are complaining of troublesome tinnitus. So this module is quite simple. It's something for you to do in your personal time, so in time that you have available for study at work or just of an evening. And it is a really simple module broken into very small sections. So the first part is the introduction that you're watching now. The second part, we actually want you to do the British Tinnitus Association Take on Tinnitus modules. These are fabulous to refer your patients to. And I keep postcards of this in my practice, and patients are regularly taking pictures to send to friends or taking one of the postcards away from them. The tinnitus modules will guide you through the same understanding we want our patients to have about tinnitus. You'll then find a fabulous presentation from Beth Ann, and Beth Ann has talked about when and why to refer tinnitus, and she uses quite a lot of case studies to explain why certain people will be referred and others are fine to be managed within a standard audiology setting. And then you'll find I come back on and I have a listening skills presentation for you, because listening is a thing that we can practice and we can get better at. So that listening skills is the final module. We have split it into those small sections, and you can come and go from the module as and when you need to, and it will return you to where you left off. At the end of the modules, we want you to complete 2 reflective practice case studies, and there's a format that you can download from the website. We want 1 case study of a person you've referred on for specialist tinnitus management. Now, that might just be a different audiologist within your clinic. It might be a hearing therapist. It might be a psychologist, or it might be an ENT that you've referred to. And there's certainly lots of referral routes for people with tinnitus. So we want you to reflect on one way you have referred, and then we want you to reflect on a case study where you've supported the person with tinnitus yourself. So where you've looked after them and you've been able to help them to manage their tinnitus better. We've actually got a little panel of tinnitus specialists who will look at those case studies, and they will give you feedback and return them to you. After you've successfully completed the case studies, you'll receive a certificate of completion for your CPD record. And as you can see, the case studies are submitted to the BAA Management Company. Do just remember that all this information is also available on the website. I just want to have a quick word about the Take on Tinnitus modules. This is a British Tinnitus Association funded project. It's run by their professional committee, and it's there for patients to work through when they have a first experience of tinnitus. It talks about the fundamentals of tinnitus, It talks about sleep and relaxation. It talks about the way that we're going to use sound. And it talks about anything else that they might want to do in terms of support or guidance. And of course, it talks about hearing and tinnitus. So the modules we want you to do encompass a wide and broad spectrum of information about tinnitus aimed at the patient, but really helpful for new professionals, new to tinnitus work, to work their way through to give them a real understanding of information that's helpful. And just an example of one of the screenshots here. So it tells you to click on the icons to find out about some of the things you can do straight away. This is all about self-management for the patient. So Take on Tinnitus is all about the patient self-managing their tinnitus experience. About 85% of respondents found that the site was really useful or very useful for them. And about 80% of respondents, when we asked again, found the site useful or very useful. So we've had 2 independent research projects checking that Take on Tinnitus is a useful site for patients and they're getting good information from that. And here you can just read a testimonial from John. What I would say from my personal experience of Take on Tinnitus is that patients really do enjoy getting information about tinnitus. It's in a form that is easy to read and easy to work through. And so it encourages them to think of this as a condition that they can manage and that they can support themselves in managing their tinnitus by doing some very simple exercises. I also love the fact that we're getting Take on Tinnitus into more GP surgeries, because although we're talking to our audiologist colleagues, we know that often patients will attend their GP first and they may not be given particularly helpful guidance or information. So if we can make more local practitioners, local GPs, local chemists aware of this resource, then this is something that will improve the experience for our patients. So, as I say, really thought about including Take on Tinnitus for you, and we want to include it because we also want you to talk to your patients about it too. Thank you for watching. If you go to the website, you'll find lots more information there on how to complete the module.